What is cradle cap? Cradle cap, or infantile seborrheic dermatitis, is a common non-contagious skin condition that affects newborns and infants. It appears as yellowish, oily, scaly areas on the scalp, similar to dandruff, but does not usually cause irritation or itching. A mild cradle cap appears in the first few months of life and usually goes away without any treatment by the baby's first birthday. It's caused by overactive sebaceous glands, which create excess oil and trap dead skin cells on the scalp. The overactivity is caused by the mother's hormones, which remain in the body system even after birth. Yeast makes the problem worse, causing further oil buildup and scaling. It's commonly found on the scalp and forms on the brows, behind the ears, and in the skin folds of the neck. A doctor will diagnose a cradle cap by a physical examination. Pediatrician immediately recognize the distinctive scaly, oily areas. No special tests are required unless an infection occurs and it spreads to other parts of the body, requiring additional assessment. Cradle cap affects between 10 and 70% of infants within their first 3 months of life, and some children continue to have small amounts of the symptoms. In most cases, they recover between 6 and 12 months. Seborrheic dermatitis is normally benign but causes secondary infection if the skin is inflamed or broken. So a dry scalp is normal in babies with a family history of skin diseases like eczema and psoriasis. What does cradle cap look like? Cradle cap looks like yellowish or brownish, oily, and scaly spots on a baby's scalp. The patches vary in size and are typically thick and crusty with a waxy feel that adheres tightly to the skin. The affected area have a greasy sheen, making the scalp appear oily, and mild redness can be seen around the scale patches in rare cases, but the baby is usually not bothered, itchy, or in pain. The scales resemble dandruff, but are thicker and less likely to flake off easily. And cradle cap primarily affects the scalp, but appears on other regions of the baby body. It frequently spreads to places like the brows, where the scales resemble dandruff, and the eyelids, which develop minor scaling. Cradle cap grows behind the ears, causing redness and scaling to the neck folds, especially in babies with cute little fat necks where moisture accumulates. And it can affect the diaper area, resulting in red, scaly patches that resemble diaper rash. Recognizing the signs and body locations help to effectively diagnose and manage cradle caps. Why do babies get cradle caps? Babies get cradle cap due to overactivity of sebaceous glands triggered by residual maternal hormones in the newborn after delivery. The hormones induce the baby's oil glands to create excessive oil, which binds dead skin cells on the scalp, resulting in the formulation of the greasy scales areas known as cradle cap. Yeast thrive in oil, so it makes the problem worse, causing irritation, scaling. Cradle cap is not caused by poor hygiene or allergies and affects healthy babies regardless of how you take care of their skin. Genetics does play a role, since infants with family history of skin diseases like eczema or psoriasis are prone to getting cradle cap. Environmental factors such as excess moisture or heat contribute to the problem by affecting oil output. And most occurrences of cradle cap are minor and disappear on their own once the baby's hormones stable out and the glands become less active. It's not contagious or unpleasant and resolves within the first year of life with little to no consequences. How is cradle cap diagnosed? Cradle cap is diagnosed by a physical examination of the baby's scalp and skin by a healthcare provider, usually a doctor. The diagnosis is made mainly on the unique look of the greasy, yellowish, or brown, scaly areas on the scalp. The cradle cap requires no lab tests or imaging because it has that distinct visual symptoms, and the doctor inquires about the baby's overall health and routine to rule out other skin problems that look like cradle cap, such as atopic dermatitis or fungal infections. In rare circumstances, the doctor orders additional testing if the cradle cap worsens or displays signs of infection, like redness, swelling, or leaking. So they take a skin scrape to check for bacterial or fungal diseases. How to differentiate cradle cap from baby rash? To differentiate cradle cap from baby rash, consider several factors such as appearance, location, time, symptoms, and reasons. So cradle cap is a form of newborn rash, easy to distinguish from other baby rashes. However, understanding the differences is critical for providing appropriate care. First, examine how it looks. Cradle cap presents as oily, yellowish, or white scales that create thick crust. Cradle cap does not produce redness or open sores unless it's irritated. Other baby rashes like eczema are red, dry, and inflamed, and heat rash has little red bumps that appear wet or prickly. Second, identify the location. Cradle cap is mostly found on the scalp, although it is found on the brows, behind the ears, and on the side of the nose. Other baby rashes develop in various regions. Diaper rash is limited to the diaper area, and eczema appears on the face, arms, or legs. Third, understand the timing. Cradle cap appears within the first few weeks of life and often dissolves by 6 to 12 12 months of age. Other rashes can happen at any time depending on external factors such as the weather, allergies, or irritants like detergents or diapers. Fourth, understand the symptoms. Cradle cap is usually asymptomatic, which means it doesn't itch or affect the baby. Other rashes, however, are really uncomfortable. Eczema, for example, is itchy, resulting in fussiness and scratching, and heat rash causes irritation. Lastly, understand the cause of it. Cradle cap is caused by overactive sebaceous glands on a baby's scalp, which are most likely regulated by residual maternal hormones. Other newborn rashes result from a variety of circumstances, like eczema is caused by allergies or genetics, heat rash is caused by excess sweating, and diaper rash by long-term exposure to moisture and irritants. Visit a pediatrician to clarify and get treatment for the baby rashes. What are the symptoms of cradle cap? Scales are the most distinguishing feature of cradle cap, appearing as greasy, thick patches that range in hue from yellow to white. They adhere to the scalp and they are sticky due to the oil. The scales cover a large area of the scalp, giving a glossy or waxy finish. Cradle cap frequently has dry, crusty patches that flake off, mimicking dandruff. Aside from greasy scales, the patches develop when dead skin cells gather on the scalp and are thick or rough to the touch. It's not caused by inadequate hygiene, however, flakiness makes the scalp appear dirty. Slight swelling around the scaly areas indicates infection or irritation. Swelling is frequently seen in more severe cases when the skin becomes irritated, so get medical assistance to avoid serious issues if swelling persists or worsens. Some infants suffer slight irritation in the affected area, although cradle cap is typically not unpleasant. The itching is normally mild, but sometimes leads to scratching, which increases the risk of irritation or infection. Sometimes it can become dry as the scaly patches develop. The skin behind the scales is dry and flaky, while the condition is greasy. The dryness extends beyond the scalp to include the brows and behind the ears. Can I comb out my baby's cradle cap? Yes, you can comb out your baby's cradle cap. Brush the cradle cap lightly to avoid irritating the baby's sensitive skin. A soft baby brush or fine-tooth comb loosens and removes the flakes, especially if the region has been softened with oil or shampoo. So soften the scales first with a small bit of baby oil, coconut oil, or olive oil on the afflicted area to properly comb out the cradle cap. Leave the oil on the skin for 10 to 15 minutes to loosen the crusty spots. Cleanse the scalp with mild baby shampoo to remove excess oil, and use a soft bristle brush or baby comb to gently lift and remove any loose flakes. Avoid plucking at the scalp with your fingers or brushing with too much pressure, as it irritates the skin and can lead to infection. Forceful removal causes redness, swelling, and even minor skin damage. Combing out the cradle cap is not necessary for medical reasons because the problem normally fades away, but it does improve the scalp's appearance and helps with excess flakes. Is cradle cap itchy? No, cradle cap is not itchy. Most newborns do not feel any discomfort or irritation from cradle cap. The illness is characterized by the greasy, scaly areas on the scalp, not with itching or pain. There's not that much inflammation involved, making the condition not associated with itchiness. The lack of discomfort is actually a characteristic of cradle cap that sets it apart from other skin disorders such as eczema. Babies can experience slight irritation in rare circumstances, particularly if the cradle cap worsens or spreads to other parts of their body. Itching occurs if the skin becomes too dry or irritated, or if the baby scratches the afflicted regions. Gently apply baby-safe moisturizer or oils to soothe the skin and alleviate discomfort, looking for symptoms of infection such as increased redness, swelling, or leaking, as they make the region more sensitive and irritating. Contact a healthcare provider for additional treatment if the symptoms appear. Does cradle cap hurt? No, cradle cap does not hurt. Cradle cap is a common, painless skin ailment that affects newborns, primarily on the scalp. It rarely causes pain, itching, or discomfort in the newborn. The skin beneath the scales becomes slightly inflamed, although the condition is not hazardous. Cradle cap rarely causes long-term skin concerns or discomfort despite its look. What are the treatments for cradle cap? Apply a small amount of baby oil or coconut oil to the afflicted region to soften the scales. Allow the oil to sit for 10 to 15 minutes to loosen the crusty places, making it easier to brush off the particles gently, and then properly rinse with warm water to avoid residual accumulation. Gently wash the scalp with baby shampoo daily. It helps to remove the excess oil and buildup leading to cradle cap, and gently massage the scalp. Then you gently brush the scalp with a soft bristled baby brush after shampooing. It loosens and eliminates the flaky, crusty spots without causing discomfort for the baby. Avoid applying excess pressure to prevent skin irritation. You should be using medicated shampoo if recommended by the doctor. The shampoos assist in minimizing oil production and battle yeast overgrowth, which leads to cradle caps. Carefully follow the doctor's recommendations to avoid overusing these products. Avoid picking or scratching the scales since they irritate the skin and create infection. Use a light hypoallergenic moisturizer to the baby's scalp to prevent dryness after washing and combing. It keeps the skin moisturized and lowers future irritation or flaking. How do you stop cradle cap from coming? 1. Wash the scalp 2 to 3 times a week with a mild baby shampoo. 2. Brush scalp after every wash. Brushing eliminates existing scales and keeps new ones from forming. On some days, you should be using a moisturizer or oil such as baby oil or coconut oil. Rubbing a tiny amount of baby safe oil over the scalp keeps it moist and decreases the risk of dryness and flaking. Avoid exposing the baby's scalp to too much heat or sweating since it worsens oil production and causes the cradle cap to reappear. Keep the baby's head cool and dress them in breathable clothing. 5. Continue regular scalp care after clearing the cradle cap. Maintaining a healthy scalp is among the steps of how to stop cradle cap. Regularly washing, combing, and moisturizing the scalp even after the cradle cap has disappeared. The baby's scalp stays healthy if harsh products and forceful washing methods are avoided. Is it okay to leave cradle cap? Yes. It's okay to leave cradle cap. Cradle cap is a common and innocuous newborn condition that fades on its own after a few months. Cradle cap does not cause discomfort, itching, or danger to the baby while it appears unattractive. Medical intervention is unnecessary because it causes little discomfort or long-term health problems. When should you consider going to a doctor for cradle cap? When the illness worsens, exhibits signs of infection, spreads to other body parts, or does not improve with routine treatment. Cradle caps are normally harmless and in some cases necessitate medical treatment. One important reason to consult a doctor is if the cradle caps get severely irritated, an infection or underlying skin inflammation that requires medical attention, such as topical antifungal or steroid cream if the affected region becomes red, puffy, or heated to the touch. Another example is when the condition spreads beyond the scalp, notably to the face, neck, or diaper area. Seborrheic dermatitis spreads to other oily parts of the skin, while cradle cap mostly affects the scalp. A doctor offers specific therapies or determines that another skin condition such as eczema causes the problem. An infection is evident if the baby's scalp begins to leak, bleed, or crust excessively, which is caused by scratching or picking at the scales. A doctor may prescribe an antibiotic ointment to cure or prevent future issues. A doctor's visit is recommended if frequent treatment does not improve the cradle cap within a few weeks. It signals the necessity for medicated shampoo or stronger topical remedy obtained by prescription. Allergic response or infection occurs if the infant is uncomfortable or fussy, clawing at scalp, or has other symptoms such as fever, requiring patients to seek medical attention. Consider medical attention if the cradle cap appears to be infected, spreads, defies treatment, or causes discomfort for the infant. What are the best products for cradle cap from my company, Organics? Superbalm Natural Baby Balm is made with organic materials such as sunflower oil, beeswax, and coconut oil and is intended to nurture and hydrate the baby's sensitive skin. The balm softens and removes cradle cap scales while moisturizing to avoid dryness. The product is free of harsh chemicals, making it gentle enough for daily use on infants and capable of soothing inflamed skin. Calendula Cream contains organic calendula known for its anti-inflammatory and healing characteristics, which are beneficial for treating cradle cap. The cream reduces redness and irritation while promoting the skin's natural healing processes. Organics' delicate formula is ideal for fragile newborn skin, restoring balance without causing additional discomfort.